Good afternoon and welcome to Can Cable 21. My name is Lucy Aquino and I'm the CEO of Hispanocare, a program affiliated with Advocate Illinois Masonic Medical Center. And today you're watching a live show. For the next 25 minutes, we're going to be talking about nursing homes and rehabilitation centers. What is it that you need to know about them? Joining me today is Cecilia Hernandez, a representative with Ambassador Nursing and Rehabilitation Center. Thank you for today, Cecilia, for being on the show.
Thank you for inviting me, Lucy.
You're welcome. Cecilia, I know that there are a lot of rehab centers and nursing homes that have taken a lot of changes throughout the years. And I know that the object and the objective for residents of nursing homes is basically to provide a specialized care, one with compassion, understanding, and treating people with respect and dignity, and especially in these types of settings. So Cecilia, can you please tell us what's a nursing and rehabilitation center?
Well, we have a lot of care for residents 24/7. We try to make them feel at home in our facility or any nursing facility. They should be feel at home. And they also have like programs for therapy and different types of activities to interact with each of the residents.
Right. So when we talk about a nursing home or rehab center, obviously the object there is to provide better health care and to have patients to live a wonderful, productive life, for whatever time that may be, and obviously recovering from that as well, from not just the patient but also for their family
members too.
Right. So, who would benefit from these types of services? For example,
anybody that's had like a hip replacement, a knee replacement. People are there for long term and short term also, and also anybody that has a chronic diabetes, cardiac, a patient, pulmonary patient. Anyone that has like a G tube or an IV therapy too.
Okay, so we're looking at people who actually need more extensive care one-on-one, more than hospital care.
Yes.
So it's a rehab center for them to get better during their time that doesn't require a lengthy hospital stay.
Exactly.
So I know that many of these nursing homes and rehab centers, a lot of times, I know out in community, people don't realize that insurances in many cases do cover this. So what types of insurances cover these types of stays and services?
Well, we take Medicare, Medicaid, also Blue Cross Blue Shield, United Healthcare, Aetna, and various others insurance also.
And I know that Medicaid, Medicare, that's a biggie.
Oh, yes.
That's a real biggie. And I know that a lot of times individuals don't realize that Medicare and Medicaid do cover these types of services.
They do.
So very important to do that. Now, obviously, when these types of services are rendered and are required, usually it starts at the hospital level, correct?
Yes, correct.
And what happens after that? During?
The social service department of the hospital and also the their primary care physician, family doctor, together, they evaluate the patient to see if they're, if nursing homes would be a good fit for them.
Right.
Especially if somebody needs, like you say, one-on-one care, 24 hours, 7 days a week. And it's helpful for the family because they know their loved one would be cared.
Right. All right. So let's say, for example, that I am at a hospital setting and I am a social worker at a hospital setting, right? And you have your mom in the hospital and she's requiring rehabilitation in a nursing home setting. And in this case, so as the social worker, obviously the physician will then make contact with me, right? At the hospital?
At the hospital.
And contact social services. And the social services department then will come down and talk to the family and to the patient. Right? And let them know what it is that this patient requires, probably for a certain amount of time and length that they will go to rehab center.
Yes.
And they will then offer them and show them some options that they can have. And in this example, let's say, for example, this is Ambassador Nursing Home and Rehabilitation Center. So now the social worker has talked to the patient, has talked to the family member who has said, okay, this is where we want to go. What's the next step after that?
Then the hospital will send a referral to our facility, and everybody, the administrator, along with social services, will evaluate to make sure that we can give them proper service.
Okay.
You know, to make sure that all the needs of the patient is met.
So then they're obviously transported via ambulance.
Yes.
And transferred to the nursing home.
Yes.
All right. Now, I know that sometimes these are decisions that need to be discussed. And even if an immediate decision is not made right there and then, it's definitely something that patients and families should talk about. And it's something definitely that should come to an understanding between the two.
Right. After the resident is admitted in a nursing home, they have a care plan meeting with the family, and they discuss the care and what kind of care they're going to, how we're, therapy. And so it's discussed among the family. The family's involved a lot.
Right. So, and this is from every step. I mean, from the moment they get there.
Yes.
Right. And from the moment of their care starting.
Right.
It's families always
involved.
And that's a big plus. And I know that, for example, many nursing homes out there, whether it's Imperial, or it's Ambassador, or a host. I mean, there are hundreds out there. And I know that, there are also places, before you make that decision and where to send your loved one to, it's always good to look and see what kind of report card these places do have.
Right.
And a lot of times that there is a place that you can go to. As a matter of fact, I'd like to share that with our viewers. And I do want to remind our viewers that our lines are open. The numbers at the bottom of your screen. If you have any questions, please feel free to give us a call. Now, I know that, let me share this with everyone. And so if someone wants to find out more and more about report cards or who's who, what's what, you can actually go visit the Illinois Department of Public Health. And by visiting that, you can go into the www.dphillinois.gov, Topics and Services, Healthcare and Regulations. And this particular site will actually take you to each of the nursing homes by name and locations, right?
Right, exactly.
And there you'll be able to obtain and get more information on each of these nursing homes and rehabilitation centers.
Right, exactly right.
And this is where you can find out they're good, they're bad, they're ugly, whatever it is, whatever the situation may be, what kind of report cards, what kind of stars they have or don't have, and so on. And so that's really important. Cecilia, can we talk about what are some of the services that are provided at nursing homes? And not just provided, but if you were that daughter who has to agree to transfer your mom to a nursing home for rehab, what are some of the things you're going to look for?
Well, since if your family member speaks Spanish, you want to make sure it's a bilingual nursing home, which Ambassador is. We have a staff there at least 10 years. We have a bilingual program, activities, menu, and also to make sure the different therapies that is offered in various nursing homes. There's a lot. It just depends. There's a plan established individually for the resident so that it would help them better their condition and to be there, to be the healthiest that they could be, whether long-term or short-term.
So obviously you're also looking for, I know that some of the things I would also look for too is, how clean is the establishment? Is it well maintained? What do the rooms look like? Who is the medical director? Look him up. What's he's all about? I mean, find out what he's all about. Find out what his history is. How long has he been in practice? Where does he practice at? I mean, these are things you want to do. You want, obviously, to have that patient satisfaction, and you want to be satisfied in all areas of care, and as well as ambiance and where you're at.
Right, exactly.
Right. Now, I know that you mentioned the bilingual part of it, so obviously we're also looking, so if you have a patient or a loved one who is Polish speaking or Spanish speaking, does this nursing home provide bilingual, bicultural care at all?
Yes, it does. Yes,
Okay.
it does.
And these are things you need to look for. You're looking at equipment. You're looking at dated things. Are they too old or freshly done? These are things you want to look at. You want to do a site visit to the nursing home before your loved one is transferred into a nursing home and rehab center. You want to go look at it beforehand if possible. Try to do that. So if you're the one making that decision or helping to make that decision for your mom or dad or aunt or uncle or whomever it may be, go do a site visit. It's it's going to be worth it that you went over there and you looked at it. Take a chance. Ask for a tour of the place. Meet the executive director if need be. Meet the head nurse in charge. I mean, these are all the things you want to look at.
Right.
Especially if it's a short term, you still want to know these things. But if it's a long term stay, it's definitely something you want to do.
Yes, something that I want to look at.
I know that transition, we talked about the social worker starting at the hospital and the physician being involved, which is your primary care physician as well. And when your primary care is speaking with the social service agency or the social service department of a hospital, obviously it's talking about what your needs are. So when you are transferred, all these messages go with you.
Exactly. So all their needs are covered.
So what are some other things that you would say, whether it's Ambassador or other nursing homes, but let's talk about Ambassador a little bit, because Ambassador I know is unique in some cases because I know they've become pretty much most recently pretty bilingual, bicultural.
Right. We have a big multicultural community in Albany Park. So we cater to that community.
Okay. And other than, I understand that your patient population there, what is your number one speaking language there?
It's
for residents,
Spanish.
Spanish is your number one. And what's your second?
A second one is a little Polish and English.
Okay. So, and obviously you have the staff who speak the language,
Yes.
who are culturally sensitive to their needs and understands it. So very, very important. This is something that's very important. And I know that many nursing homes today and rehab centers are also looking on their focus on doing things like this and looking at what services they're providing, how they're providing it, and the languages they speak, even upon hiring associates.
Exactly. We have a big multicultural staff.
Can you tell us a little, what am I missing? Oh, I did want to mention and take advantage of this too, is that the Ambassador is having a 40th anniversary.
Yes, we're celebrating our 40th year in the Albany Park community. We are going to have an event on September 18th, starting at 12 o'clock, music, food, live entertainment. It's open to the community. Please bring your family. We hope to see you all there. And it's going to be a good time. This is like really big for us, and everybody's on board to make this event successful, but the only way is having the community join us.
Right. What else can you tell us about nursing homes and rehabilitations that we should know about?
Well, they always try to provide a loving environment for the patient, number one, and also a lot of activities for them to interact with the residents and the patients at the nursing home. And also we try to, the therapy is very intense. It depends on what the resident is coming for, but it's a very excellent therapy department, and restorative is therapy 6 times a day usually, and restorative is like 5 days a week, twice a day sometimes. But
Can you give me an example of a typical cardiac patient who's coming in for rehabilitation? And what does a day typically look like for them?
Well, usually the therapy department sets up and they take them to the therapy. They do like exercise, bicycling. They start them off slowly because they usually come just right after surgery, and it progresses every day. Right. Once therapy is done, doing like their cycling, their exercises, and walking with the patient, then the restorative department takes over, and they do sometimes twice a day. They go to the restorative department. They also do like exercise, walking, but at the resident's pace, so that it's there to help them. So
patients are encouraged.
Yes, they're encouraged
to move forward and as far as they can go.
Yeah, exactly.
Right. Right. And so obviously, so you have a lot of cardio going on as well.
Yes, we do, a lot of it.
Do some of your now the Ambassador? I know you have a few sites.
Yes, I mean we have other nursing homes that are
Right.
sister homes.
Right, and I know that, I want to say Infinity is also part of that.
Yeah, Infinity's the company name,
Mhm.
and we also have other homes besides Ambassador, like I said, other sisters' homes.
Right. I do want to remind our viewers that we do have, our lines are open, and if you should have any questions for Cecilia or myself, please give us a call. The number's at the bottom of your screen. Again, I also want to give you Cecilia's contact information. And if you have questions regarding the nursing home or if you rehab center, and in particular Ambassador, you can reach Cecilia at Ambassador Nursing and Rehab at 4900 North Bernard Street here in Chicago, area code 773-583-7130.
Yes.
Thank you. Now, I know that I want to go back a little bit about the celebration. It's 40 years of servicing the
Albany Park
community, and you've been at this particular one location.
Right.
And can you tell me how big is this establishment? How many beds?
It's a 198 bed facility.
It's a large facility.
Yes, we have 3 floors.
Okay. And I know that you do. Do you do some of the activities that are also available for residents? Can you talk a little bit about that?
Oh, they play bingo, loteria in Spanish. They also have weekly outings. They also have movie day. They also have a lot of like groups, coffee groups,
Right.
and other kind of activities. Sometimes the Hispanic women get together and watch the novela together.
Oh, that's great. Now I know we had a caller on the air.
Hi, yes, I was just trying to figure out if you had assisted living or if all the residents were independent.
No, our facility is a nursing home. It's not an assisted living.